We're just going to give a couple more folks an opportunity to join, and then we'll get started. All right, I think we're ready to get started. We want to make sure we have enough time to hear from all of our speakers. Thank you all so much for joining us for Thank you all so much for joining us for the meeting today. We're excited to share more about the Count All Kids initiative and how we can collectively prepare for the 2030 census. But before we jump into those details, I just want to share a small note with you all as you're entering the meeting that we are recording the meeting, and we will distribute the recording and the slides afterwards. All right, so we will go ahead and jump in. Welcome again. I'm Marquita Little Newman, and I'm the Executive Director at the Partnership for America's Children. And for those of you who aren't familiar with the Partnership for America's Children engages, empowers, and invests in a network of state and local advocacy organizations working to improve policies affecting children from birth to adulthood at the local, state, and national levels. And we support our member organizations through funding, capacity building efforts that strengthen their policy knowledge, advocacy skills, and organizational development. And the partnership is not alone today in hosting this important conversation. We are joined by our partners in this work, as well as the co-sponsors of this meeting, the Coalition on Human Needs, 0 to 3, and First Focus. Thank you so much to each of our partners for the ongoing partnership and collaboration, as well as being a voice for children and families. So today you'll hear from several speakers as they share more about Count All Kids. But before we invite our speakers to join the conversation, I just want to share a bit of context and more about the purpose of today's conversation. So every 10 years, the Census Bureau must comply with a constitutional mandate to capture an accurate count of the nation's population. This constitutionally required count affects the apportionment of congressional seats and the distribution of public funds. One historical issue that we're aware of with the count is that young children from birth to 4 are consistently undercounted, and this is more than any other age group. We also know that the risk of being undercounted is even higher for children in immigrant families and children of color. So our efforts to count all kids accurately really can have immense implications for building a strong foundation for young children in the decade to come, because as I shared, because of the key role that the census count plays in public funding as well as political representation. So in the next hour, we are going to discuss more about this key issue, why it's important for child advocates, as well as exploring ways for all of us to get engaged in this work. Next slide, please. So just to give you a preview of the agenda for today and what our speakers will talk more about. You'll hear more about why the census is important, specifically for child advocates. You'll also hear an overview of the Count All Kids initiative and how we engage in this work. We'll also share ways that you and your organization can get involved. And finally, we'll conclude our time together with a few questions. And as a small final bit of housekeeping, we are going to save time at the end of the presentation for your questions. However, if you have a question that comes up, you are free to drop that question in the chat, and we will capture those and make sure we come back to address those once we get to the Q&A section. Okay, well, I think we're ready to jump right in. So again, thank you for joining us, and I want to turn things over to Deb Stein from the Coalition on Human Needs.
Marquita, thank you so much. Becca, if you could show the next slide for a moment and then go to the one after that. So this section is on why you should engage in the census, and the speakers will be myself, Molly Rose Schaffner, and Michelle Delafiore. And if we go to the next slide, what I want to talk to you today is about is the problem, which Marquita has roughly introduced to you, but I can get a little more detailed for you. If you look at the slide on the left, it shows you what we call the net census coverage rates for young children, older children, and adults. Net coverage rates are the final total number that we have for people in any particular age group or group in general. And it includes both the people that were, it accounts for both the people that were missed, and sometimes people are double counted. What's happened with young children, and by young children we mean ages 0 to 4, is that from the period of 1950 to 1980, the count of everybody, young children, older children, and adults, got consistently better. And you can see that on the far left of the graph. But then from 1980 until 2020, the count of older children and adults kept getting better, but the count of young children continued to get worse and worse. Everybody did a little bit better in 2000, but kids didn't, do anywhere near as well as everybody else. It just didn't keep dropping, but then it did keep dropping in 2010 and 2020. So we have this problem where the count of kids is getting worse, even as the count of adults is improving. The count of young children, ages 0 to 4, is much worse than any other age group. The count of children of color is about twice as bad as the count of white children. And if you think about this, this isn't about families not responding, because what happens, and part of what explains this gap, is that often young children are left off the census form even when families respond to the census. And in fact, one of the first things that Count All Kids did was we conducted the first ever public opinion poll on what people thought they should do on the census and what they would do. Would they count their young children? And if not, why not, or what would persuade them to? What our research showed is that about 1 in 5 parents of young children with incomes under 50,000 or less either would not count their young child or did not know if they should, and it was kind of half and half. And subsequent research has also supported that. For some reason, about 1 in 5 parents simply do not think they should count their young children, or they don't know if they should. Now, this has significant complications and implications for children. And so I'm going to take us next to Molly Rose Schaffner and the next slide, and she's going to talk about the data implications. So Molly Rose.
Thanks so much. Like Deb said, I'm Molly Rose Schaffner. I'm here with 0 to 3. And first, thanks to all the colleagues on our call today. 0 to 3 has been really, it's been a pleasure to be part of the Count All Kids Coalition, and really proud of all the work that the coalition has been able to do. At 0 to 3, we've been particularly concerned about the undercount of babies and are really grateful to the Count All Kids Coalition for the leadership in this space. At 0 to 3, we rely on census data in a multitude of ways, but one of our clearest examples is through our State of Babies yearbook. And if you're not familiar with the yearbook, it is a large compendium of data that has statistics from every state, and much of the data is actually pulled directly from the census data. For example, I think 8 of our indicators are derived from the ACS survey, which does come from census data, obviously. And those would be above low income, in poverty, in deep poverty, below 150% SMI, low income uninsured, families living in non-metro areas, and families living in crowded housing. So if you could please go to the next slide. So on this slide is just a little snapshot of an example of how we use data to tell the story of families living in every state. So relying on the data from the census allows us to put together state-by-state data that advocates can use to call on lawmakers at both the federal and state level to work to improve outcomes for babies and families. We really imagine the yearbook as a blueprint for enacting bold policy solutions that babies and their families need to thrive, bridging that gap that we often see between science, data, and policy. And we also hope that policymakers and advocates can use the data and our accompanying analysis to identify and advance policies that provide that really comprehensive level of support that we're all advocating for. I hope that that really quick summary of just one of the ways that we use this data was helpful. Sometimes I find it hard to kind of envision that connection between the data and action and how we're using it to really tell a comprehensive story. But that's one of, sort of our success stories in the way that we're using data. And Deb's points about, the undercount and needing complete and accurate data really shines through here. And I'm actually going to pass it to Michelle.
Thank you, Molly Rose. Hello, everyone. Good afternoon. Michelle Dallafor. I work at First Focus on Children, where I cover budget and tax policy, and have been happy to participate in this coalition, Count All Kids, because of the important work that we do here as a group, because we need to improve the count of all children. As you just heard, it's pretty alarming that we're not getting better at an accurate count of kids. And I'll just start with a top line thought for you all in terms of the share of federal spending on children. We spend less, that share is less than 10% for all children under age 18. And working with Molly Rose at 0 to 3, we put out a baby's budget toward the end of the summer last year, and less than 2% of the federal funds go to our youngest kids. So we've got work to do there. We need to do more investment. And what would help is if we had a better count of kids. So we're gonna keep working to do that. So the Census Bureau put out a report back in June, I think, and it might surprise you, but over 350 federal programs use decennial census programs data in whole or in part to distribute more than $2 trillion. It's approaching $3 trillion, and that's the fiscal year 2021 number. So a lot of resources rely on different data sets from the Census Bureau. And those funds are allocated from nearly every department. I was looking, and I think I didn't see the Department of Energy on the list of programs, but I think just what every other department is, and then independent agencies as well, to support education, healthcare, housing, feeding children and families, economic development, highways, healthy environment, and so much more. The data derived from the decennial census, as well as other data collections and targeted surveys, you heard the American Community Service, is the measure, and that ACS is to measure the changing social and economic characteristics of the U.S. population. It is a nationwide continuous survey designed to provide communities with reliable and timely social, economic, housing, and demographic data every year. So the decennial census every decade, this is data that's used annually. So a little bit generally how the data can be used. It can help to define eligible recipients, for example. The data can be used to define geographic areas, so which states and local governments and populations are eligible for the funds. Think about programs that are targeted at urban areas or rural areas, for example. And then the data is also used in formulas to guide the allocation of funds to eligible recipients. They use ACS data to direct the distribution of those funds, and you're looking at things like median income, poverty rate is often used, unemployment rate, median rent, for example, are some of the points used to distribute the funds. And then agencies also use the data oftentimes for competitive grants that they might put out for states and other entities to compete to receive those funds. Let's see here. Going to the chart. So this chart, what I tried to do with this chart is I looked at the list of the 350 plus programs and pulled from the top 40 in terms of the amount of funds, and then did a crosswalk with our budget book and pulled from the largest programs funding for kids in the top 25. So it's a little bit of a crosswalk showing the programs that are in the census list of using data for distributing funds, and then the top KID programs. And you'll see the funding level in there for FY23, and then the third column over there is just whether or not we determine that 100% of those funds are for children, or if there's a multiplier we use to determine the amount of funding going to kids. So then just going through a couple of programs to talk a little bit, a little bit more in the weeds, but like Education's Title I that supports schools in lower and families in lower income areas. They direct the percent of children living in poverty. So they're using the poverty data. It has an impact on how a lot of the Education Title I funds are distributed. Child care, for example, there's a mandatory and a discretionary funding stream, and they're looking at kind of how the funds are distributed historically, as well as the number of children under 13. So they're looking at population estimates, for example. And then they also rely on other programs that use census data, like the share of children receiving free or reduced price lunch. The WIC program, for example, is using ACS data, and it also is looking at children who qualify if they are under 185% of poverty, for example. And then Medicaid, another big program that supports children and families, and those funds rely on the federal medical assistance percentage, or FMAP as they call it, which in turn is based on state per capita income. So a number of programs that you've probably heard mentioned rely on census program data to distribute those funds. So again, we are underinvesting in our kids, and we need to do a better accurate count so that all of those most in need are receiving adequate resources. So thank you, and I will turn it back to you, Deb.
Thank you. So next slide, please. The next section of this webinar is about how Count All Kids engages in this work, where our effort is to improve the count of kids so that we get better data and more funding for them. And I'm going to talk about what we do at the federal level. Jasmine will talk about what state groups have done in the past, and Amy will talk us through what we can do over the next 6 years to get ready for 2030. Next slide, please. So I want to first share what some of our accomplishments have been. We really just started this work in the middle of 2018. And when we did this, people would sort of pay lip service to the idea that young children were missed, but they had no idea what it meant. Why were young children missed? What should they be doing to improve the count? There was this sort of assumption that if you just made sure you got all the households to respond to the census, somehow you'd get all the kids. But in fact, that's not true. We know that many families won't count their kids, and also some of the households that young children live in, like complex households, you end up getting some of the household, but not everybody. So, grandma, parent, child, the grandparents might not count the young children. Or if a sister is also housing her sister and their kids as well as her own, she might just count her own family, but not her sister's family. So what have we done, and how has that helped lift up the need to count all young children? Well, in 2019, we conducted the first opinion research ever on counting young children. And that research showed, as I said before, that 1 in 5 families either wouldn't count their young children or didn't know if they should. We also, in that research, asked what messages would persuade them to count their young children, and we found that the most important messages tied counting young children to funding for services for children and families. Based on that research and on the fact that they really hadn't been doing anything different to count young kids, we were able to persuade the Bureau to form a 2020 census undercount of young children, young child task force. And we worked closely with it throughout the 2019 and 2020. That group was able to do 2 really important things. They really changed how the Bureau was working on counting young children. came up with a lot of new strategies, including special mailings to households in communities likely to have young children. And it also really changed the communications campaign for the Bureau so that they didn't just talk about the need to respond to the census, but also to count everybody when they did. Then in 2020, which is when the census happened, we led a nationwide effort with groups working in nearly all the states to try to persuade families to count their young children. And as you may remember, that was the year of the pandemic, so the census got extended. Instead of starting April 1st and then only going for a couple of months, it didn't end until mid-October. So that was a big, long push with a lot of groups, and we gave them social media resources and op-eds and all kinds of resources that they could use to help push out the message they have to count everybody. In 2021, we said to the Bureau, we know that this is still a big problem. The task force for 2020 was a really good model, but we also know that you miss children in census surveys like the American Community Survey, as well as in the decennial census. You really need to create a group that works on the undercount of young children in all of your products. And they did that in response to our request. And we meet monthly with that group to share concerns, to learn from them. And one of the things we do that's really important with them is we share the research of our demographic consultant expert, a guy named Dr. William O'Hare, who has conducted most of the important research on young children, certainly of the research that's been done outside the Bureau itself. Unfortunately, in 2022, we learned that the count of young children got worse in 2020. Now, we don't know if that's because of things like the pandemic, the very bad political environment around immigrants, which made immigrants scared to respond, the threat of putting a citizenship question on. There was also a period of several years where the census was really underfunded and couldn't prepare. We like to think that the count of young children was at least somewhat better because of our work and would have been even worse without it. There are lots, I mean, the census is generally considered to be a failed census, but whatever, we know that the count of young children got worse, and we really have a big problem we have to address. The thing that was good in 2022 is that Dr. O'Hare was analyzing the Census Bureau's new approach to protecting the privacy of individual people. And it's a new, different approach called formal privacy or differential privacy. And he was able to show that their approach separated parents from children. That's a problem for many reasons with decennial data, but we got very concerned about what that would do if they also applied it to the American Community Survey, which they were planning to do, because that would destroy any ability to have child poverty data, because kids generally don't have income, and we measured how kids are doing in terms of income by looking at the household income. Well, we can't measure child poverty if we've separated the adults from the kids and we don't know what the adult income that the kids are living with is. But in December of 2022, the Bureau announced that they had been persuaded by us and other people that the science was not ready to apply this new privacy approach to the American Community Survey. And so for the future, foreseeable future, immediate future, we still have that data. The other thing we did in 2022 that we think is really important is that we called for the Bureau to conduct research on using administrative records to supplement household response. Many children are in administrative records like WIC or SNAP or Medicaid that don't get included in their family in the decennial census. And we called for the Bureau to conduct research on whether they could use those administrative records to go to the individual household response in the census and add the young children. And our success in 2023, one of them was that the Bureau announced it would conduct that research. The other thing we did in 2023 is that we wrote the Bureau asking them to develop a broader, bolder research for 2030, because we said this count is getting worse and worse, and if you don't do something really different, you're not going to reverse it. We offered them a whole series of things that we thought they should do, and we're currently in the middle of a really fruitful conversation with their researchers, where we're connecting them with private experts they didn't know about, who are expert in things like low literacy and how to work with people with low literacy, a whole range of things. So we're really pushing the Bureau right now to improve its research and come up with new innovative ways to count kids besides the administrative record approach that they're already testing. Next slide, please. So how do we do this? We do it by working with a wide range of groups. First of all, we work with two kinds of groups at the Census Bureau. I've already talked to you about how we partner with the Undercount of Young Children Working Group, and we meet with them monthly and share our concerns, Dr. O'Hare's new research. They bring specialists in that talk to us about what's happening inside the Bureau, and we figure out what that means for the count of kids. The second way that we work with the Bureau is that there are two census advisory committees, and both of them have young child advocates on them. And we meet with those advocates before those census advisory committees meet. We walk them through the issues that the committee has on its agenda and what the implications are for kids. When they ask us to, we draft comments, recommendations that the committee can make to the Bureau, and they frequently use the recommendations we've suggested, put them in the committee recommendations, and then we get responses from the Bureau, and the Bureau very often accepts those recommendations. So those two committees each meet twice a year. So 4 times a year, we're working with the members of those committees to develop recommendations to the Bureau, many of which get accepted on how to improve the count of kids. The second set of groups that we work with is what I would call the National Census Advocate Group. There's a whole community of census stakeholders, which is sort of led by the Leadership Conference on Civil and Human Rights. And we have a seat on their stakeholders task force and participate in a wide range of activities there, including an effort to look at the undercount of racial and ethnic groups in their whole number group. There is a separate group called the Census Quality Reinforcement Task Force, which was put together in anticipation of the fact that 2020 would be a failed census, and that is continuing to look at the results from 2020 and come up with recommendations about how to improve the count in 2030, but also how to fix the undercount from 2020. So for example, the Bureau has developed a different approach to its population estimates, which should improve the funding allocation even where it uses 2020 data, because it also uses administrative data. And we are working with CQR, with that reinforcement task force, and the Bureau to get them to focus on the parts of that population estimate that particularly matter for funding for young kids. There's a group called the Census Project, which is probably the oldest of all the census stakeholders at the national level, and which leads a lot of the advocacy around funding for the census, particularly in terms of coming up with good estimates of what the Census Bureau really needs. The third thing that we do is we lead a group called the Count All Kids Committee, which is a whole group of national child serving organizations, where we have monthly calls. We update them on what's going on, and we invite them to join us in submitting the recommendations to the advisory committees, to responses to Federal Register. We've engaged in projects with them. They were hugely important in 2020, and we are very much looking forward to working with them as we build towards 2030. And then Coalition on Human Needs also has a very wide network of national human needs organizations that have a big focus on funding, and they often join us when we're particularly raising issues that have implications for the census in terms of funding for child and family federal programs. So we work widely with national partnerships. What I want to do now is turn this over to Jasmine, who's going to talk about how Count All Kids worked with state and local groups in 2020.
Thanks so much, Deb. Hello, everyone. Good afternoon. So glad to be with you all. I'm turning off my camera just so I don't get disconnected. You can go to the next slide, please. Thank you so much. During the height of the pandemic, advocates adapted and developed creative ways to encourage households to fill out their census form, and of course, to include young children. In the next few minutes, I will share quite a few examples of how advocates spread awareness and mobilize communities, and hopefully spark ideas for how your organization can engage as well. I know there are a lot of outreach examples that may not be represented in this presentation, so please feel free to include others in the chat. In the next slide, you'll see how advocates identified specific geographic locations, household types, and languages unique to the communities where they focused their outreach. For example, in DC, the Children's National Hospital used data, and I think I saw Mark Mather on here, so I'll specify PRB data and response rates to locate neighborhoods that had increased risk for undercounting young children. They noticed that a major barrier for residents in the identified areas was their limited access to internet. So the Children's Hospital gave their census champions a list of places of worship, hospitals, and health centers in those areas that provided free Wi-Fi. Going on to household types, many advocates released messaging and formed partnerships with organizations or government agencies that interacted directly with non-traditional households. Deb named a few, but for example, grand families as well as foster families. Advocates in Oregon trained the youth in their statewide youth-led foster program to spread awareness among peers within their network about the census. And then finally, with languages, a lot of advocates researched the languages that were popular in historically undercounted neighborhoods in their communities. And they reflected those languages in their targeted social media ads, as well as in their partnerships. So for example, partnering with ethnic radio stations throughout the state. In the next slide, you can see how advocates were intentional in partnering with trusted messengers in their communities, which ranged from Girl Scout troops to local librarians. In Kentucky, advocates partnered with teachers to use Census Bureau materials to spark discussions about the census among their young students. In Connecticut, they hosted census parties at childcare centers, which allowed people to fill out the form using the technology at the childcare facility, but also while their children were still being provided for. And they use that same technique at local volunteer income tax assistance sites throughout the state in partnership with United Way. Advocates in multiple cities across the nation partnered with diaper banks to print census stickers on diaper bundles that were distributed to families with babies. Michelle, you remember that one. There were several states you can see on this slide. That We Count book is a children's book that explains to children what the census is. So several states distributed that We Count book during home visiting sites. In the next slide, you can see that there were so many methods and strategies to really engage the community. Target messaging to specific groups and localities with media ads were a very efficient way to use social media. So for example, media ads with Facebook, YouTube, music streaming platforms, and radio PSAs. So a quick example for PSAs, advocates in Connecticut partnered with United Way again to share public service announcements about the census on that 211 hotline while callers were placed on hold. A lot of community interaction and education. I'm going to name a few examples. In Indiana, advocates collaborated with the public transportation department to pay for tail wraps on the back of public buses. So as you know, those go for 12 hours a day, at least 6 days a week, where people are seeing those messages. The National Wake Association encouraged its local groups to include census messaging in their packages, and schools did something similar within their grab-and-go meals. So during the pandemic, as you recall, schools were just handing out bags with meals in it, so they would put the census information in there. As a Prevent Child Abuse America grantee, South Carolina advocates sent census information in the Prevent Child Abuse boxes. And similar to that method, advocates in Virginia sent census materials in those Go and Grow bags that are given to families when they have a baby. And everyone loves product swag. So there was a lot of census swag that was going around. We had census messaging on baby onesies, on baby bibs. There were a lot of state color books with specific census data on it. You can see an example on the slide. And a lot of those trusted messengers that I mentioned earlier were also wearing buttons with information about the census to spread awareness. So intentional partnerships and creative outreach methods allowed the message to meet people where they frequent in several different formats and often by people that they already trusted. So I know you're thinking, Jasmine, we're 6 years away from the next decennial census. What can I do right now? So with that in mind, I am excited to pass it over to my colleague, Amy Vertle from the Leadership Conference.
Hi, everyone. Great to be with you all. And thank you so much to the Count All Kids Network for hosting this call today. I'm Amy Vertel. I am the Senior Program Manager for Census and Data Equity at the Leadership Conference. And as Jasmine said, I am really excited to share with you all today some tools that you can use to help you plan your advocacy efforts and understand what we should all be doing now to ensure a successful 2030. So if you can go to the next slide, I am really pleased to introduce you all to our Roadmap to 2030 website, if you have not yet seen it. So as we've heard from all of our speakers on the call today, we as census advocates need to be taking action now to ensure a successful 2030, including a complete count of young children. It may feel early in the decade, but 2024 is really a pivotal year, as we've heard. So to guide advocates on the census planning cycle and actions that we need to be taking year by year, we launched our interactive Roadmap to 2030 website late last year. So I will put the link for that in the chat in just a moment, so that we can all see it. Okay, so link is in the chat. And essentially what the Roadmap website does is map the planning milestones for the Census Bureau's preparations for 2030, and also outlines a timeline for advocacy actions. So it really is a map to what advocates can be doing now that coordinates with the Census Bureau's planning cycle to ensure success in 2030. And in addition to mapping these milestones, the roadmap also serves as a resource hub. So if you, let's say, dive into the section for 2024, you'll see that this is sort of the beginning of the Census Bureau's period of engaging stakeholders on LUCA. And so you might say, what is LUCA? I have no idea. You will find resources there that will explain what LUCA is. It is the local update of census addresses, where the Census Bureau collaborates with local governments to update its master address file. And you'll find all kinds of tools that can help you to take action around the LUCA program, just as an example for 2024. So we are really excited to share this website with all of you. We hope it'll be useful, and we hope that you'll share it with your networks as well. This website will also be continuing to grow and develop in the years ahead. We are assembling more and more resources. We're building out a live calendar for census-related events. So we really encourage you to, if you have resources to share, send us an email. You can find the email address both on the website, but I'll also drop it in the chat. Let us know if you're planning any events. We'd be happy to share them on the calendar on our roadmap page. And we just encourage you all to interact with this site as much as possible and let us know what you'd like to see added there. And then I also just wanted to invite everyone on the call today to join us for our Roadmap to 2030 convening on April 2nd. We hold this convening yearly on or near Census Day to kind of serve as an update for advocates on what is happening around preparations for the 2030 census, and also to dive into the roadmap and look at the actions that advocates can be taking at this point in time and in the years ahead to make sure that we are ramping up for a successful 2030 census. So at this year's roadmap convening, as I alluded to, Luca, the local update of census addresses operation, will be one of our key topics. Luca begins in 2027, but requires a lot of planning and ramp up. So we will be talking about how advocates can get engaged in that effort. And we will also just be looking at the Census Bureau's 2030 strategy plans more broadly. The Bureau has been releasing information about their planning process for 2030 over the past couple of months, and we are continuing to update the roadmap document with that information. So we'll look at some of the latest updates on the Bureau's planning for 2030. So we hope that you will join us. I don't think we've circulated an invite for this officially yet, but we will make sure that everyone who's on the Count All Kids list gets the invite to the Roadmap for 2030 event. And again, it will be on April 2nd, so we encourage you to keep an eye out for that invite. And in the meantime, if you want to be sure that you are on our list and getting our updates, we encourage you to join our States Count Action Network, affectionately known as SCAN. And SCAN is really the wide network of state and national advocates that we send periodic updates to. We send a monthly newsletter, as well as kind of action alerts when there's something urgent happening around census planning. So I will drop the link to sign up for the SCAN listserv in the chat as well. And we encourage you to sign up so that you can stay up to date with all of those resources. And if you are interested in becoming a member of SCAN, we also hold periodic calls. You'll get the invites for those. And we have put together a shared Google Drive of even more resources for SCAN members that you can also access. I think I can drop the link for that in the chat as well. And of course, if you have resources that you think would be useful to share with other advocates, please do let us know. And we will be happy to share those both through the SCAN network and on the Roadmap to 2030 site. And I think with that, I will turn it over to the next speaker, but we really hope to see you all on April 2nd. Please do check out the Roadmap site, share it with your networks, and let us know what else you would like to see there. Thank you so much.
Deb, I think you're muted.
Amy, thank you very much. You can go to the next slide, please. And welcome again. This is the How Can You Engage part, and I am Debbie Weinstein with the Coalition on Human Needs. What I'll start with before we get into some of the ways you can get engaged is with a very practical recognition that engaging does require resources. And so the first part that I'll talk about, if that's piqued your interest right away, is the funder group that supports national advocates realizes that to do this work, resources are necessary. And we've been working with them, and some of this message I'm about to deliver comes in concert with them. They're working to identify possible children's funders who might support this work, to put together a packet of materials, to approach them, and to reach out to engage them. All of this is going to be very helpful to you. So this group is called the Census Equity Initiative. That's the funders group. They have a pooled fund they use to support work at the national, state, and local level. Funds from this pool are currently working to maintain core infrastructure, over this 10-year period. They're keeping things going now at the national level and in key states, while trying to develop infrastructure in states where the census count did not perform well in 2020. As we near the 2030 census, the hope is this fund will grow and that additional support will flow to states to help ensure a complete count of young children that you've heard we have to work hard to get to, and other groups and communities that are consistently left out. Now is also the time for you to help to engage state and local funders on the 2030 census and to ensure that they understand the importance, how they can support it, and why they need to start now, because the Census Equity Initiative can't necessarily do all this work of securing funding on its own. We all need to help with that. Working in cooperation with the Census Equity Initiative, we'll share resources that are made available to help you raise funds and let you all know when opportunities for funding arise. And if you identify funders that you think might be interested in supporting census activity, please let us know, and the funders will reach out to encourage them to do so. So this really can be a coordinated collaborative effort. We really hope that this will add to your development plans for this year and through 2030. The Census Equity Initiative and we, the groups on this call, will try to support your fundraising as much as we can. And so that's just a precursor, knowing that getting engaged and doing this work does take resources. So let's go to the next slide. And that is, Becca, I hope you will be able to put the poll up on the screen, because we want to learn a little bit about you and what your interests are. So if you can respond to this poll, which I guess is one question, but to say what your preferences are, what are most important to you, and jump right in and answer these questions. I know we can't force everyone to answer questions. So, but if you, I know there's more of you that have answered. So if a few more of you want to jump in and answer, that would be appreciated. Well, okay, I don't want to take too long with this. Do we, compatriots in this, or do we, I think people can see what the poll says. Am I right about that?
I think you may need to show the results, Becca. I think
Okay,
only those
share,
can see them right now.
Okay, someone has shared the results. So you can see the large numbers of people have said learning more about who's missed and how to reach them. Also large numbers joining the network of state groups working on state efforts. And pretty large joining the state, National State Coalition, which is good because we really want you to do that, and inviting a speaker to a virtual event. So these are all things we can help with. And we will be in touch with you to help you get engaged in all these ways and telling you more about that. So let's move on to the next slide to tell you ways you can get engaged. So here are two ways. there are two listservs that operate somewhat differently. You can sign up for both. One is the Count All Kids Committee listserv, which does have meetings, monthly meetings. The listserv is not, it will not overburden your email. 2 to 3 emails a month will ramp up, I suppose, a little bit over the ensuing years, but right now that's about it. So it gives you the opportunity to learn and share with other advocates the latest information about how to improve the count. So that is one way of getting engaged. And the other is the Count All Kids Coalition listserv, which is not a group that meets, but that does share information. And the information is very valuable. Some of the information might be webinars or other events that would be useful to you. Certainly will share resources, sends out about 2 to 5 emails a month. So that is another way for you to become engaged and connected to get the information. Now let's see. The link to sign up for these, I am going to put in the chat in a second.
I believe Becca just did.
Oh, okay, terrific. Thank you. So you can, the live link is in the chat. You'll be getting all the data, the slides and resources from this webinar in a follow-up email, so you'll get it that way too. So those are two very important ways to be engaged. And one additional way, if you can go to the next slide, is requesting a presentation. In the poll, that wasn't the one that most of you clicked on, but give it some thought. And of course, we will be very happy to follow up and help to arrange something for you. You know, up to the 2020 census, we engage in lots and lots of presentations. So we hope you'll ask for that. If you want to request a presentation, as it says here, contact Joseph Battistelli, who works with the Coalition on Human Needs, and his email address is there. That's another way to become engaged. So that's just to give you the tips on ways we hope we will continue to work together because of how important all of this is. The accurate census results in money flowing to your communities as is really needed. The ability to do the analysis about poverty and access to healthcare and other services. So we hope you will stay engaged. So right now we can see about whether there are questions. Right, so thanks, Jasmine just lifted up a question that had come up before about family resource centers. Is there data that would support family resource centers? I don't know if somebody would want to take a stab at answering that question. I do know that there is not a dedicated federal funding source for family resource centers, but there would be lots of ways that you could use data to show the need for support for such centers in your community by being able to talk about the number of families in a given geographic area, their income levels, their access to healthcare and other services. But does anybody want to leap up out of our speakers to add to that?
Sure. So, let me say, first of all, that a lot of the original analysis of which federal programs use use census data to allocate federal funds was done by a guy named Andrew Reamer at George Washington University in a project called Counting for Dollars. Um, he, his website is often helpful on this. I agree with Debbie. I don't think there is a federal funding stream, but in addition to using census data to advocate for funds, one of the areas that people are just starting to look at is where states might use census data to allocate state program funding. And so even if we don't have federal funds that are allocated using census data, you might want to take a look at your state process for allocating family resource program money to see if the census data is, determines where those programs go and how much money they've got. I hope that helps a little.
Yeah, and I'm not an expert about this, but I do know that it might be possible that a family resource center might choose to um, take advantage of existing grant type funding that might be available at the federal level. It might want to make a case that it wants to perform a particular service that they could get federal grant money for. If they want to do that, again, the census data would be able to document that in this community, here's how many families with children, here are the number of families where both parents work or income levels, documenting numbers of people perhaps who are uninsured or other kinds of access to services that the census survey data might provide. And so those are ways you could use the census data, and you want it to be accurate to make your case. Are there other questions?
So Tracy put a question in about which federal programs have rely on census data, and a whole bunch of people put really useful information in the chat. And I want to let people know that we'll share that afterwards. I did want to comment just for a moment that the single biggest federal funding stream to states that is affected by federal data is the group of federal Medicaid assistance programs, or FMAP. And those are Medicaid, CHIP, child care, foster care, and adoption. That funding stream for each state is determined by the total state population, not just the young child. And the more you miss people, the less federal funding you get. And those are obviously critical programs for children. It's also the single biggest pot of money. There are a number of other children's programs that also are heavily affected by census data. So the child care, the part that's FMAP, is the mandatory funding, but the appropriations dollars, the discretionary money, is allocated using census data. For child care, WIC is affected by it. So there are a number of programs like that, and we should have a fact sheet that should be ready in just a couple of weeks that we'll be sharing with everybody with more specifics about which children's programs are allocated using federal funds. I will say that both Title I and special ed, federal data matters a lot, although the Title I money isn't directly allocated that way, but it's sort of indirectly allocated that way, and then special ed is directly allocated that way. But we'll get you guys fact sheet, and I'm working on it at this moment. And Joan, I'm glad you're going to be excited to get it. Yep.
Well, thank you very much for that. I know it is 3:01, and so we don't want to hold people too long, so you can go to the next slide where I express my thanks. And of course, on behalf of everyone who participated in this, thanks to you for joining in. getting together now, starting this work to understand what we have to do to get to the most accurate census we can, where all kids are counted, people of color are counted, that we have to work together starting now. So thanks for doing this with us. We will send the follow-up email with the recording, the slides, and the links so that you can join in. So I think we've finished our webinar, and thanks to all of you for participating.
Thank you.